Good morning, good afternoon. So I'm actually calling from Singapore, so it's a bit early for me in the morning at the 4 a.m. in the morning. Um, so this space is a virtual space which I created working with Dr. Vance from Colorado State. This is actually part of my PhD program. So the virtual space is using a tool called Spatial I/O. And so I used the basic framework for the spatial I/O and then ended up actually creating quite a bit of customization in order to create this virtual space. So when you come into my space, I'm actually logged into the virtual space for radiation oncology for education and collaborative learning. So as part of the lending, so you come into the central area, which I call meet and greet area for collaboration learning. And on the left side, there's a space or a workshop to basically go over the radiation oncology, which is basically using Linear Accelerator. So there are a lot of educational contents which are organized from physiology of the cancer, the biological processes, and different diagnostic and treatment options to treat different cancers. And then the eventual focus is, how do we treat cancer using radiation oncology? So if you continue to navigate on the space, on the right-hand side is the actual. So on the right-hand side, there's the actual cancer care treatment options. So where the patients can actually go in, and this gives you a pretty good glimpse of what actually happens in the OR room where the radiation is given to a patient. So if you continue in this space, so there's the standard CT scanner, which is often used as an imaging modality to diagnose cancer. And then on the right side, so we have, it's a little bit slow to navigate here. Let me just turn off my camera just to make sure that we have enough bandwidth. Okay. So as you can see on the right side, so that's the actual linear accelerator, which is basically used for delivering high dose of radiation to treat different types of cancer. And so there's a patient on the couch here. This is a relative of the patient. And there are a couple of nurses or radiation therapists, which are basically trained to deliver radiation therapy. So the motivation behind creating this virtual space was that how can we create a learning environment where the trainees or the medical students can go into the virtual space at any given time, anywhere, and still get trained on radiation oncology and also the fundamental of oncology. So just kind of getting back to the landing space, let me just kind of walk you through the contents of the presentation. Okay. So the problem statement was, so basically there are multiple modalities for both imaging as well as treating cancer. So the current gold standard for radiation therapy is the use of linear accelerators. So these machines are extremely expensive. They roughly cost about $2 million, and typically a hospital usually have one or two of these machines in the radiation bunker. And the way the trainees, the radiation oncologist or the therapist or even the medical students, they have to go physically into the clinic, into the radiation bunker, and then get trained on these machines. Since there are usually only one or two machines in the hospital, so these resources are highly constrained, and it's extremely hard to schedule any time for training. And moreover, even if the trainee actually get into the radiation room, they usually have about 15 to 20 minutes in order to really manipulate and learn about the equipment, which is not very practical. The second thing is that a lot of these training and the interaction with the machine requires multiple sessions of training, learning about the patient's setup, learning about to move the gantry, for example, patient setup, and eventually delivering different doses depending on the location and the size of the tumor. So this current way of training is not very practical, and also is often used basically the videos or some sort of slide deck, which makes it very difficult for the trainees to retain that information. And I think the biggest downside of the current method is lack of immersion, convenience, and flexibility. So our goal was to basically create this virtual space where trainees can come in at any given time, and on their own terms, they can basically navigate the space, learn about the oncology, learn about different stages of cancers, learn about different techniques, both for diagnostic as well as for treatment options, and then also go through the operations room to really get to know the machine and the patient setups. So what are some of the target learners? So as I said, so typical radiation therapy, so there's a multidisciplinary team which is responsible for delivering the therapy, which usually consists of oncologists, radiation physicians, therapists. They're often medical students as interns, academic staff, and these trainees are experts in the radiation therapy and the physics which is involved in terms of calculating the dose based on the location and the size of the tumor. And they're usually pretty savvy about using a technology, whether it's a radiation machine or using a cloud-connected server to be able to store all the DICOM images and be able to view them. And when you look at the demographic of a lot of these trainees, so these are typical from a gender perspective, male, female, age group anywhere from 20 to 60 years old, have some sort of background in radiation and oncology, and these are basically healthcare professionals or the medical students who want to be healthcare professionals. And we expect them to have the basic, the VR knowledge in order for them to navigate the space and basically follow the avatar to go through different contents in order for them to become familiar with the space and learn about the fundamentals of oncology and radiation therapy. So the learning model is the behaviors learning model. Our focus is that in a VR space, you basically learn by doing. And by creating this space that the trainees can go in anytime at their own convenience, and they can interact with the machine, they can learn about the contents, they can go through the videos and audio illustration in order to get familiar with both oncology as well as radiation treatment option space. It is a collaboration space. A lot of trainees can come in, they can collaborate, they can share notes, and they can jointly go through these different contents and also be able to manipulate or interact with the radiation machine in order to become familiar with the radiation equipment. So in terms of the education space, this is the medical education space. So the primarily use case, which we're exploring as part of this work, is to really train the oncologist and radiation therapist on the radiation machines. So just a bit of description of the learning environment before I navigate into the space. So as a landing page, this is more of a meet and greet space. As you navigate through the space, there are a lot of different learning contents, again, from physiology, basic physiology of the cancer, different cancer types, what are different treatment options, what are the different stages of cancer. And then also there's a bit of practical training, which is still built in work in progress, where the trainees can actually interact with the machine and be able to manipulate certain components for delivering a radiation therapy. And then as part of the assessment, so as they come into this space, they basically go through a pre-assessment, and that's where we gauge their knowledge. And then after they go through the space, then they basically go through the post-assessment, and then we compare the scores of pre-assessment and post-assessment in order to determine their overall retention of knowledge and how much improvement they have made by the time they come into space and by the time they leave the virtual space. So in terms of content organization, so there are multiple presentations there. There's some audio contents. Again, they cover the basics of oncology and also different treatment options. But our main focus is on radiation, and there are other modalities as well. For example, chemotherapy, pharmacological solution as well. But as part of this work, the focus is purely on radiation oncology. So just a little bit more description of the contents and how the contents are organized throughout the space, and I will maybe kind of walk you through how the different presentation and the contents are organized for easier navigation for the trainees. So the criteria for the spatial was really about this idea behind having a realism so that you can immerse the trainee being in the actual OR room and being in the actual training room with other trainees so that they can actually share their knowledge and collaborate and learn a lot of these contents as they navigate through the space. Feedback is extremely important. And also the movement support. So the movement support really comes from, again, be able to manipulate the gantry on the linear accelerator, move the couch, for example. This is 6 degrees of freedom for the couch. And also the KV imaging, which is being used as a cone beam CT construction when you target a given anatomical structure where the patient has a tumor which needs to be radiated. So we were also looking for a platform which has a customer, basically a cross-platform support, as Spatial does. So these are some of the learning objectives. So really you want to improve the spatial awareness, enhance retention and recall. But the fundamental goal was to reduce time to competency. And how can we actually provide them the convenience and a space for people to come in anytime they want and learn about the basics of oncology at their own terms. So just kind of going back to the assessment mechanism, there's a pre-assessment survey as you come in, and then after you navigate through the space, they take the post-assessment. So a lot of these surveys are actually built in Qualtrics, and we collect a lot of the data and then compare their scores both at the pre-assessment and then a post-assessment to determine how much improvement they have after they've gone through the space. And we often look for general feedback, user feedback in terms of enhancing this experience. So just kind of the key takeaways as we navigate through the space is really a user-friendly virtual space, very easy to onboard, and relatively easy to add contents. And it basically supports a lot of different formats, from audio files, video files, different formats, and then has really good integration with the Unity as well as Sketchfab. There's an excellent support for customization of avatars. So eventually our goal is to make this navigation totally autonomous by programming a lot of these avatars so that they can actually take the trainees through some structured navigation and take the individual through the contents. So what we have seen as part of the data we have collected so far, that there's roughly about 35% improvement of scores when the trainees go through this immersive training and their own convenience and navigate through this space. Users find it a lot easier, and a lot of the contents are self-explanatory, and it's easier to navigate. And they can go back, as they feel, if they have to repeat certain contents. So, in a summary, we feel that by empowering the radiation therapists and other trainees to train anywhere and anytime, it's really a powerhouse, and we got a lot of good feedback. This is going to be a way of really training the radiation therapist and increasing the skills in the future. A huge convenience factor, really allows for collaboration, learning, and we are using this VR space for some of the use cases. For example, orientation of new employees or new engineers so they can become familiar with contents, processes, and application of a given company. And our future work is going to be really building some interactive models with a LINAC machine and also customization of these avatars.